Welcome back, everybody. From Root Cause Wellness Center, I want to welcome nurse practitioner Nargis Fezabadi. Thank you for joining us.
Absolutely, a pleasure to be here.
So Nargis, you have Root Cause Wellness Center. As a nurse practitioner, what did you see in medicine that you said, I want to go from conventional medicine to kind of this functional medicine and start this clinic?
That's a great question because I believe that a lot of people have heard the term functional medicine, but they're not quite sure what it means. I've actually practiced conventional medicine for a little bit over 15 years.
Okay.
And I did conventional medicine before I transitioned to functional medicine. And I would say conventional medicine is excellent when it comes to emergencies, surgeries, or acute illnesses, right? But the type of people that come to me now with functional medicine are the ones that have a lot of symptoms for years, and they still don't feel well.
Okay.
So basically, to answer your question, what is functional medicine is actually very simple. In conventional medicine, we're trained to answer ask two questions when a patient walks in. We are trained to ask ourselves, what is the diagnosis and what medication treats it?
Okay.
In functional medicine, however, we only ask one question, a different question. We ask why.
Okay.
And we just keep asking why until there's no more why left.
Okay, so that's what, like you say, gets you the root. That's part of the root of where it's coming from, right?
Exactly.
And so you saw that as a shortcoming in conventional medicine, where it's like we're just writing prescriptions for things and not really getting to that root?
Exactly. So before I got into functional medicine, I was in cardiology setting. I am board certified as a cardiovascular nurse practitioner. And so I was helping patients after their heart attack, after their pacemaker, after their open heart surgery. And I knew that 80% of that early heart disease is preventable. And I was like, why I don't get to the front end and just help them prevent it? And again, conventional medicine is great when it comes to emergencies, but when we want to get to the root cause, I think functional medicine can do a little bit of a better job.
Well, for our community, 55 plus, there's things like fatigue, brain fog, poor sleep, weight gain, things that happen as you get older. Can you get to the root of that? And is there a different approach from conventional medicine that you take?
Yes, usually with those symptoms, what happens, people go through a doctor and they're being told that your labs are normal, which it is true. Think about your lab results. You get a report when you do lab tests.
Your cholesterol, your blood pressure.
Exactly. So in your report, you have your value, your result, and then there's a reference range. That reference range is designed to identify diseases, not optimal health. With 55 plus community, we see a lot of symptoms like fatigue, brain fog, chronic pain, poor sleep. And usually that reference range is not going to show much. They're usually related to optimal thyroid function. It's related to hormones, blood sugar regulation, nutrition. Gut health is huge. Lifestyle, sometimes I call functional medicine as the lifestyle medicine. So we look at those criteria and see where we can find the root of these symptoms.
Okay, so I come into your office, I say, these are my symptoms, these are some of the things I'm going through. What is the diagnostic start? What do you do for me that's different from what's conventional medicine's happening?
One thing is different because I've served both worlds. One thing is very different is we spend a lot of time with patients. It's usually like the intake or the initial consultation is 60 to 90 minutes.
Oh, wow.
So it's a lot of active listening to the patient to see where they're coming from, what's their history, what symptoms they have been experiencing for years, what helped, what hasn't helped. So I would say 80% comes from just listening to my patients.
Which is one of the things that so many doctors and nurse practitioners can't do in the conventional side of medicine is they have these appointments are back to back and they have just a few minutes. What's going on? Okay, let me give you a prescription. Okay, great. Have a great day. And they run off to the next room, right?
Exactly, because they have 10, 15 minutes for each patient. They have to listen to you. They have to refill your medications, order labs, review labs. They have a lot to do in 10, 15 minutes, and they have to chart at the same time, right? But in functional medicine, because we have the luxury of having more time to spend with each patient, we can just sit down and just talk one-on-one for again, 40 minutes, 45 minutes.
Okay, great. And from that, you take some things away, and then what are the next steps? Do you try to come up with a treatment plan? Do you do more tests, more labs, things like that?
We do more labs, and the labs we do, they're a little bit more in depth. For example, when it comes to thyroid function, it's not just, if you're familiar with the TSH, it's not just at that. We have like 5-6 different biomarkers to look at the thyroid. We just take a deep dive into more biomarkers, inflammation markers.
Okay. And are those some of the things that are overlooked in the kind of the root causes behind symptoms or what's going on?
Yes, definitely, they're overlooked.
Okay. What are some of the other things that you feel like conventional medicine isn't getting right and that you guys are making sure you take care of?
The biggest one, again, is just listening to the patients and the optimal range, I would say. The reference range that I talked to, in functional medicine, we have optimal range, which is like a lot narrower than the reference range. With optimal range, we want people to be healthy and feel their best.
Okay. And in terms of treatment, what are you guys doing that's different? I know you have, it's called the Exo...
ExoMind?
ExoMind, there we go,
Yes.
the ExoMind.
Yes.
Tell me a little about the ExoMind.
So ExoMind is one of the newest technology that we have added to Root Cause Wellness Center. It's basically FDA cleared to treat major depressive disorder. It's just this magnetic stimulation on the left side of the brain that's responsible for our mood and cognition. And we apply that to treat major depressive disorders.
Okay.
But besides that, we can also help people with poor sleep, fatigue, and low focus, just for better mental clarity. Like CEOs and poker players come and do this ExoMind because they want to have that sharp focus.
That clarity?
The clarity of mind, exactly.
Wow.
It's like the brain longevity, I would say.
Okay, so it's non-invasive, obviously. We saw the video there of the kind of goes on top of your head. What is happening? What is it resetting? What is it calibrating in the mind with these magnets and how it's working?
Yes, it's non-invasive, and the sessions are like 25 minutes. Basically, you're just sitting there very relaxed. The device goes on the top of your head, and you feel a very gentle tap. What the machine is doing is sending the electromagnetic stimulation. It's the transcranial magnetic stimulation, TMS therapy that has been out for years, over 30 years, to treat major depressive disorder. So that same technology is put in this machine, ExoMind. Now we can use it for mental wellness, not just major depressive disorders. So basically, it's gentle tap and it's transcranial magnetic stimulation that's happening.
Okay, and so name some of the things that people can go in and say, this is what I'm having, these are the challenges, like depression, fatigue, are those all things that this treatment can help?
Yes, so it's basically for fatigue, for poor sleep, for anxiety, depression, ADD, ADHD, early Alzheimer's, dementia. When they can name words, they can use this machine for. Okay.
Now, is this something that people come in and say, I've lost myself, I'm just not myself anymore? Is that one of those things you feel, oh, okay, I see where we might be going here as you kind of do that evaluation?
Yes, this is one of the devices that I usually recommend because almost everyone can benefit from this device. Again, it's non-invasive, and it's painless. You just sit there, relax. Some of my patients fall asleep during it, and when they finish the session, they get up and they're like, oh, it feels like I just woke up from a good nap.
Okay.
They feel refreshed, lighter.
Okay, interesting. You guys are in Laguna Hills, you're right down the street.
We offer Super Bill, and they can use FSA, HSA cards. But for the labs and the medications, if we have to prescribe any medications, we can use their insurance.
Okay, terrific. So it sounds like it works well with our community here in Laguna Woods Village. Nurse practitioner Nargis Fezabadi, thank you so much for joining us today.
Well,
I appreciate
thank you.
that.
Thank you so much.
You're watching This Day. We'll be right back.